COVID-19, as we know by now, negatively affecting South Africa's health programs, particularly the circumcision program. Far fewer men have been circumcised in the past year than in previous years. That's according to the health NGO Right to Care. Let's find out what that has actually meant for the fight against HIV. Senior Technical Advisor Dr. Nelson Igaba joining us. Dr. Igaba, good morning to you. So I've set the scene, but I don't think I'm able to explain properly just how much COVID-19 has set the HIV program back. Help me understand that. Good morning.
Good morning, Gareth. Good morning to your viewers this morning. Yes, you are right. You are spot on. The COVID-19 pandemic has not only affected the circumcision program, but other HIV care and treatment program. This has been well published in the recent times. And just to stick on how VMMC has been affected, last year when the hard lockdown was implemented around March 26, the circumcision program was also suspended, and it remained suspended for close to 6 months. And that affected the momentum that the Department of Health and the support partners like Right to Care had put in place to make sure that we circumcise at least 80% of all men above the age of 15, between the age of 15 and 34, so that we can enjoy the benefits of medical male circumcision.
Talk to me about, Doctor, talk to me about why that more men have been testing positive for sexually transmitted infections. There's been a bit of an increase, hasn't there? Help me understand the correlation between not going for circumcision, COVID-19, and more men now contracting sexually transmitted infections since COVID-19.
Yeah, thank you, Gareth, for that question. Maybe let me just start by telling you the other benefits of male circumcision before I come to that. It has been proven through randomized clinical trials. These are gold standard research in medicine that medical male circumcision can reduce the transmission of HIV from an HIV positive female partner to an HIV negative man by 60%. And that's not the only benefit. The other benefits, of course, when you're circumcised, you have better hygiene. And again, we know that when you still have the foreskin, it bears some of the virus that cause cancer of the penis. And that same virus, which we call human papilloma virus, it also causes cancer of the cervix in females. When you are circumcised as well, you enjoy the benefit of reduced risk of acquiring sexually transmitted diseases, like those ones that cause ulcers, like herpes and syphilis. So basically, what I'm trying to say that all men out there, they need to get circumcised so that they can enjoy the benefit of being circumcised. With lockdown and COVID-19 and unemployment and many other challenges that are coming to that, we are seeing many men, having to engage in risky behaviors. It has been proven that many men in South Africa have more than one sexual partner. So the risk of getting STIs in men is quite high. When you get circumcised, you reduce this risk very well.
Dr. Igaba, I don't think all men have to engage in risky sexual behavior. I think it's a choice in the end. But before I say goodbye to you this morning, what do we do to try and fix this now? If someone is watching, they think, okay, they agree with what you're saying, they want to go for circumcision. Is that even still possible during lockdown? In the last minute I have with you, is it possible, and where can men go if they want to? Before I say goodbye.
Yes, thank you very much, Gareth. It's very possible, and that's why we are here calling men to come to our facilities to come and get circumcised. All our facilities we have implemented infection prevention and control at the facilities supported at Right to Care. All the males that are 15 years and above, please come to our facilities. Any facility near you that is supported by the Department of Health, you can go there and inquire, and you'll get the circumcision services. On the other hand, we have a 24-hour call center at Right to Care, where you can send a please call or you can call in, and there will be a clinical person on the other side who will respond to your call and who will book you into a facility, and you will be approached there. And the phone number is 082 808-6152. I repeat, is 082-808-6152. And just to reassure the public is that when you come to our facilities, we make sure that we observe all the COVID-19 protocols. We make sure that we screen you for COVID-19. We screen you for STIs. We screen you for other diseases like diabetes and hypertension. And in case we find you to be having any of these challenges, we'll channel you very well into the structures of the National Department of Health so that you can get appropriate management and treatment for whatever ailment we find with you. So all men who are not circumcised, 15 years and above, please come to our facilities. We will handle you with well-trained, specialized clinicians, and you'll get your circumcision, and we'll follow you up until when you're healed.
All right, I appreciate you speaking to us this morning, Dr. Nelson Igaba, Senior Technical Advisor, speaking to us this morning regarding right to care and the call for circumcision for men, going as far as to say that there's anecdotal evidence that it does reduce sexually transmitted diseases. If you want that number again, and maybe you did miss it, here it is again, 082-808-6152, 082-808-6152.